Well, this summer, bike riders from beginners to experts will be raising money for cancer research in the Empire State Ride Long Island. All the money raised will help cancer patients at Catholic Health and the Roswell Park Comprehensive Cancer Center in Buffalo. And joining us now is Dr. Bhoomi Mehrotra, Chairman of Oncology Services at Catholic Health. Thanks for joining us this morning.
My pleasure, Colleen. Thank you for having me.
I love the idea. This is the first time we're going to try this ride. And as we all know, money is needed to fight cancer. Tell us about the partnership between Catholic Health and Roswell Park.
Yes, this is really an amazing new relationship that Catholic Health has forged with Roswell Park. As you know, Roswell is really one of a select number of institutions in upstate New York. Across the country, there are about 30 such comprehensive centers which are funded by the National Cancer Institute. And Roswell is in the top few institutions, particularly because of its focus on research. So we are really delighted with this partnership. We have an excellent network of community-based multidisciplinary programs across the breadth of Long Island. What we want to do is take this forward and move the field of oncology forward. The treatment of cancer has evolved very rapidly over the last 10 years as we have gotten a better understanding of the biology, of the DNA of the tumor cells and its relationship with our host environment and sometimes with the genes that we are born with. The only way we move forward in our field is by participating in clinical trials. We are trying to move the treatment in a positive way that balances the effectiveness of the treatment and maintains the quality of life of the individual who's navigating that journey. And for that, we need a better understanding of the biology of the tumor. We need a better understanding of the immune system, the body's self-response to the tumor cells, how we can combine our traditional therapies such as radiation therapy, chemotherapy, surgery, integrate them with biologically targeted therapies with the new way of treating cancers with combining immunotherapy that stimulates the body's own immune response to recognize these cancer cells and destroy them, and therefore improving survivorship. Ultimately, that's what this is about, but also maintaining the quality of life with reduced side effects.
Well, the partnership with Roswell, being part of the care network there, that's relatively new.
Yes.
How is the partnership changing cancer care here on Long Island?
So we now have the ability to have access to those proprietary clinical trials that the investigators at Roswell have been developing. They are in some key areas of vaccine therapies, of immunotherapies, of biological therapies to overcome resistance of the traditional therapies to the cancer cells. And we are now opening, in fact, we have opened several clinical trials and actively recruiting our community participants to further their care right here in Long Island so they don't have to travel. In addition, because of the relationship of Roswell with the National Cancer Institute, we have now become an affiliate of theirs in a large cooperative cancer investigation body that's called an alliance program. And we now have been able to open clinical trial access for our communities in breast cancer, colon cancer, lung cancer, pancreas cancer, and all the common cancers, solid tumors as we call them, as well as malignant hematology, myeloma, leukemias, lymphomas. So all those novel agents and novel treatment paradigms are available to our communities right here on Long Island by virtue of this partnership. And it is really exciting for us.
So before, Long Islanders would have to travel to get these clinical trials. Now they can do this close to home.
Yes, we are delighted to say that they are open and available. And we encourage everybody to reach out to our centers, which are really spread across Long Island, which are really evidence-based multidisciplinary programs. We are privileged that we are able to provide the spectrum of care from screening programs to multidisciplinary treatment, which is constantly a relationship between the surgical doctors, the medical doctors, the radiation doctors, the pathologists, the radiologists, all the way to pastoral care, to nutritional care, and when appropriate, palliative care and hospice care. And Catholic Health has really an amazing array of colleagues that provide these comprehensive services. But to take it to the next level, we need the research trials so that we can break those barriers that are hindering the survivorship.
You were just talking about the cancer centers. Catholic Health has 4, and really we've seen them open up because they're just so beautiful. They've been renovated, and where everything is done under one roof. Again, the patients don't have to travel from place to place to place. You're getting it in the center, as you say.
Yes, we have 2 major hubs, St. Francis Hospital, as well as Good Samaritan Medical Center. And then we have 2 additional programs at St. Joseph's Hospital and Mercy Medical Center. And it has really been an amazing experience for us to see our colleagues come together under one roof and work hand in hand with each other to personalize each individual person's journey. And now it is even more exciting that we can offer them novel therapies and improve their survivorship from this bolt of lightning that hits them and their family members when they're given this diagnosis.
That's exactly it. It is a bolt of lightning. And now we need everybody to know that they can help fund research, fund these trials by getting on their bikes. I know you're preparing for the 62-mile ride, right?
Absolutely. I will be rooting for everybody. So, yes, as you mentioned, we look forward to seeing all your viewers and members of our communities on July 24th at the Theodore Roosevelt Memorial Park in Oyster Bay. I'm myself a longtime resident of the town of Oyster Bay, so I'm delighted that my town is hosting this relationship between Catholic Health and Roswell Park. We would love to have everyone join in this great cause. As you mentioned, research is expensive, but it is the only way we can move forward. And the funds, 100% of the funds that will be collected are earmarked for promoting research efforts.
Oh, I hope so many people. You don't have to do 62 miles. There's also a 10-mile that the families can do. So little kids can do this even. And also there's a 25-mile. As you said, town of Oyster Bay, the beautiful North Shore, what a great place to ride. That would be just a fun day for everybody too.
Yes, we're looking forward to it.
So everybody needs to check out the website. It is esrlongisland.com. And the more support, the better. Thank you, Doctor.
Thank you very much for having me.